Hello friends, today we are going to discuss about World Mental Health Day Celebration 2021. I'm Dr. Suresh Badadmat, Professor of Psychiatry working at NIMHANS, Bangalore. World Mental Health Day Celebration 2021. Every year we celebrate this day on 10th of October. This started in 1994. Why should we celebrate this day? What is the need? And every year we have a theme. What is this year's theme? And what we can do to achieve the meaning of this theme. The objective of this celebration is to sensitize, prioritize, and focus on important aspects of public mental health. This year also we have a theme. This year theme is Mental Health in an Unequal World. Of course, this pandemic has created a global crisis in terms of health issues, social issues, economic issues, educational issues, and triggered a global crisis. And coming to mental health issues, it is difficult to explain because it is felt in every part of the globe. In this unequal world, the rich is becoming richer, the poor is becoming poorer, and gap between the haves and have-nots is increasing. This pandemic has polarized the world, and the unequal world has accentuated. Access to healthcare has widened in terms of the people who are rich are easy to access the healthcare, but the people with poor or less money cannot access any kind of health. Coming to mental health, it is simply impossible to access for health. Treatment gap for mental health is widening further. Before pandemic, it was 70 to 80%. Now it has increased further. Focus on physical health has become the norm during the pandemic. But unfortunately, this norm has come heavy on mental health and has taken the toll. Lockdown, social distancing, stress of pandemic has caused severe mental health issues in every citizen of every country. COVID infection triggered pandemic, but the mental health has become norm and also a problem for every citizen across the country. Domestic violence in women and closure of schools has caused severe problems in children. Geriatric population are threatened of life, causing more anxiety and depression. Comorbidity, especially with physical illness, has created more trouble to the population. The stigma and discrimination experienced by persons with mental illness has become enormous during this pandemic. Access to mental health care has becoming more and more difficult. Available resources have been pumped for physical illness and providing care for pandemic, and without any resources for mental illness. Homeless mentally ill had a tough time during this lockdown. Non-availability of medication, non-availability of mental health services, severe stress because of pandemic has caused either relapse of pre-existing mental illness or else precipitation of mental illness in vulnerable population. Often, the poor people are hardest hit during these disasters. They face higher risk of illness and also mental illness. Whenever they have to access for healthcare, they have to pay. Once they have to pay, they become more poor. This unequal world has widened the gap between have and have-nots. What to do? The only way to do is to bring in a proactive legislation and to implement. I think there are three important ways to do it. One is right to access for mental health care, right to equality and non-discrimination with regard to access for healthcare, and also right to legal aid. All these three components has been incorporated into Mental Health Care Act of 2017 of India. Let's discuss about these three important provisions, how at least we can attempt to make this unequal world to some extent equal. Under Section 18 of Mental Health Care Act, which talks about right to access for mental health care. Right to access for mental health care means access to inpatient services, outpatient services of mental health care, access to free essential psychotropic medication, and also rehabilitation services. And these access should be having awareness regarding mental illness, affordable, acceptable, adequate in range, and also appropriate with regard to quality also. Let's understand the need for equality and non-discrimination as per Section 21 of Mental Health Care Act. This section clearly talked about some of the very important provisions which needs in this unequal world. First and the foremost is every person with mental illness shall be treated as equal to persons with physical illness in provision of all health care. This is a very important. The reason being is the physical health gets priority, and especially during this pandemic, mental health has been completely neglected across the world. At the same time, there is a need to provide ambulance for persons with mental illness who require urgent treatment. Unfortunately, during this pandemic, you have seen across the globe the ambulance were denied for persons with mental illness. Hence, right to access for ambulance as equal to physical illness should become a right. At the same time, right to emergency facilities and services for mental health care as equal to physical illness should be given priority. Every insurance company should consider incorporating mental illness. They cannot just have an exclusion clause telling that mental illnesses cannot be included. In our legislation of India, Mental Health Care Act clearly talks about mental health care cannot be discriminated. It has to be treated in par with physical health with regard to medical insurance. Further, a woman with mental illness who is taking care in a mental health establishment cannot be separated from her child if the child is less than 3 years. If they have to separate because of the safety of the child, then the psychiatrist need to certify, and every 15 days they have to decide whether she continues to be harmful to the child. Even in that period, under the supervision, the mother has access to her child. This is one of the best and beautiful clause where mother and the child bonding continues to be given priority. Let's move into the Section 27. In this unequal world, by saying equal, it is not possible. The persons with mental illness need to fight for their rights. Hence, right to legal aid becomes very important tool. Hence, in our Mental Health Care Act, Section 27, right to free legal aid has been given. A person with mental illness shall be entitled to receive free legal aid to exercise their rights. To conclude, my dear friends, this global pandemic requires united global response. It cannot be patchy response from developed country neglecting the developing country. That should not happen. And underdeveloped countries are completely ignored. It's not the way. This pandemic requires united, comprehensive, global, proactive response towards the health. Health is not just physical health, including mental health. Hence, it is prudent to have a proactive legislation to protect the persons with mental illness at the national and also international level. And the globe, in this world, every citizen need to fight together against this pandemic. Please do remember, there is no health without mental health. Thank you very much for giving your valuable time. Stay safe.